I'm Prachi Gupta. Welcome to today's COVID Bulletin. Efforts by the Indian Institute of Technology or IIT Guwahati will now cut down the country's expenditure on COVID-19 testing. The institute has now come up with an affordable yet high-quality viral transport media, RNA isolation and RT-PCR kits to attain self-reliance in COVID-19 testing. Scientists have developed a viral transport medium named spilled VTM that ensures that the RNA in the sample remains intact while transportation. RNA isolation kits that enable extraction of a high-quality RNA from samples and RT-PCR testing kits have also been developed. The kits have been developed as per the standards laid down by the GMCH, and approximately 950 VTM kits have now been tested and validated. The large-scale production of all these kits has commenced to meet the requirement of Assam, as well as it will be made available across the country. These indigenous kits have been developed in collaboration with Hyderabad-based RR Animal Healthcare Limited. Let's hear more on this from the experts.
Presently, the government of India procures these kits from abroad, or we are importing these kits. That was the reason these kits were very expensive. Second reason is that these kits, even the small parts that are included with the kits, like the swabs or the vials that are available, even they were not of very high quality that were being used. So we tried to indigenize this thing, the kits, the swabs as well as the vials, and we used our own research scholars in this, to prepare these kits. That was the reason that we could bring down the price, and the quality that we developed with these kits was very high. So as such, technically the grade that we used, or the method that we developed to prepare these kits, the CDC method, and this was what was requested by the Guwahati Medical College and Hospital, and that was the reason that we used this special method to prepare this kit. Okay, and this has been validated now, and the hospital, Guwahati Medical College and Hospital, are using it. So as such, the science is not different. Okay, but the methodology that we have used is, we have developed on our own, and as per the requirement of the hospital, Guwahati Medical College and Hospital. So based on their order, we can scale it up to whatever level we want. And we have also been talking to a few other big suppliers and distributors, so we can also scale it up to a few lakhs immediately.
Once you get the virus through the swab in the VTM, its RNA has to be extracted. So you need a kit for that. And once the RNA is extracted, that RNA has to be amplified. So the second kit is the real-time PCR kits. So both the kits again are imported in India. And under these COVID pandemic conditions, the kits are not available. There is a huge shortage because all the states, all the different places, there are massive screening going on. And the problem in the Assam is that because of the influx of the screening procedure, these kits are in real shortage. Now, with our technology and expertise and using the technology, we have made this indigenous kit in Guwahati, IIT Guwahati, with our students, and these are very effective and low costing, affordable. These are the main things.
Researchers from the Indian Institute of Science or IISC are building Koswara, a diagnostic tool for COVID-19 based on respiratory, cough and speech sound. The project has 3 stages: data collection, modeling and diagnostic tool development. Currently, the project is in the first stage, where voice samples of COVID patients and healthy individuals are being collected. The voice samples include breathing sounds, cough sounds, phonation of sustained vowels and counting numbers at a slow and a fast pace. Other than this, the information of participants' gender, location, health status and pre-existing studies is also taken. The data is collected using web and mobile application. In the next stage, the collected data will be analyzed using signal processing and machine learning techniques. Mathematical models will be built that can aid in the identification of infection prints from voice samples. Finally, the team will develop an online tool or app that will inform users about their probability of having COVID-19 based on their voice samples. If developed, such a tool will be zero cost and non-invasive diagnostic method that can supplement the currently used COVID-19 testing procedure. Let's hear more on this from the experts.
So the technology is like a data-based algorithms, like the data science or the artificial intelligence that people come to call it. So you take the audio sounds, you derive some features from the audio sounds. Maybe, let us say, for example, it could be the periodicity. So how periodic is certain cycles in your audio of the breathing cycles, or how periodic is the cough cycles. So when studies have shown that when you are breathing or when your lungs are compromised due to infection, the harmonic nature, meaning the periodic nature of the sounds, is also compromised. Things are all over the place, so there is a lack of periodicity in the sounds. And by collecting enough samples of of healthy individuals and people with COVID-19, we can try to develop these kind of algorithms that separate healthy individuals from those suffering from COVID-19. And eventually, the idea is that given it is purely based on sound, purely based on the cough samples and respiratory sound samples provided by the participant using a smartphone, if we come up with a diagnostic tool in this direction, it is going to be fast, because the artificial intelligence algorithms are going to provide answers within a matter of few seconds. Is going to be inexpensive, so that everything is done with the smartphone itself. All it requires is to query the smartphone tool using the new data, and most importantly, it will come across as contactless testing, so that the participant himself or herself can test it at their end. They need not come in touch with any healthcare workers or the hospitals, and thereby they can keep the social distancing norms also in place. So if somebody wants to get tested, it is quick, it is fast, it is going to be contactless, and therefore these are more like pre-screening tools.
As the coronavirus cases spurt in India, so does the requirement of high-quality masks. Providing a sustainable solution to this issue, the Indian Institute of Technology, or IIT Mandi, has now developed high-efficiency masks from waste PET bottles. The mask developed through this procedure cost only 25 rupees and can be washed and reused up to 30 times, and is at par with N95 respirators. To develop these masks, researchers shredded waste plastic bottles, dissolved the plastic using solvents, and finally extracted nanofibers from the solution. As per the scientists, a single thin layer of these nano-woven membranes provides desirable particle filtration efficiency. The nanofibers in the mask also provide breathability apart from good filtration efficiency. The cost and the quality remain two prime concerns for the mask buyers, and both of these have been taken care of by this newly developed mask. Let's hear more about this mask from Dr. Sumit Sinha Ray, Assistant Professor, School of Engineering, IIT Mandi.
So it's practically a 3-ply mask that is something that we have developed here. And in this 3-ply mask, the invention is in the middle layer. So generally in the 3-ply mask, which are regular medical or surgical mask, which are all 3-ply, the main efficiency comes from the middle layer. And that is something which we call melt-blown layer, and outside some spun-bond layers. So what we are trying to do here is to replace this melt-blown layer, because they are also made from polypropylene. So instead of that, generating new polluting materials, what we are doing is we took the waste plastic bottles, which are PET bottles, unbiased, any company, okay, any kind of cold drink bottle. So we take these bottles, we shred them into pieces, dissolve into certain concentration of solvent, and we extrude polymer fibers out of it. And these fibers are in nanoscale, and the scale is 1/250th of one human hair. So in that sense, these are very thin, fine fabric. So then this layer is sandwiched between two very thin cotton layers. So cotton is used for friendliness, human friendliness, and also if you throw it, it won't pollute that much. After several washes, it still shows more than 75% efficiency at 0.3 micron. You use it for 6-8 hours and you have to throw it, whereas this one you can use it for many days. It is much more breathable. You want to make it fashionable, you can make it fashionable. But it is the most important thing is breathable. Few days, a couple of our doctors from our medical unit at IIT Mandi, they are also using it, they are washing it, reusing it, and they have told me that they feel fine.
That is all for today. We will be back with another edition of COVID-19 Bulletin soon. Namaskar.